Hey guys, it's Christine Lim again. So a month ago, I visited CSA Medical Aesthetics and kinonsern ko kay Doc regarding my skin. Like, sabi niya, your skin is good but it can do better. So, nag-come up kami with Rejuran and na-excite ako kasi lagi ko narinig yung Rejuran. Like, it's really famous in Korea and here in the Philippines, nadala na nila. So, na-amaze ako kay Doc kasi the way she explains everything, mas lalo ko naiintindihan yung mga skin boosters, why we need it, na kahit good yung skin mo, it can do better talaga. Like right now, after a month, sobrang ganda ng skin ko and nagpa-schedule talaga ako agad. And while she's doing my treatment, like the Rejuran, ang dami kong natutunan sa kanya. Like, nakwento lang niya sa akin kung why do we need that? Why maganda yung Rejuran? And na-amaze ako kasi ang galing talaga niya. She's so good with what she's doing. Ayun. So, yung concern ko is my under eye since nag-lose ako ng weight. I do pickleball, ganyan, run. So, nag-lose yung, parang medyo mababa yung hair ko and also here yung napansin ni Doc. So, we will be having maybe fillers and also part 2 of my Rejuran. Yun yung pinaka-request ko kasi I saw my skin super glowing. Ayan. Don't forget to like, subscribe, and hit the notification bell there.
Hello everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa and we are with Christine. In the past, we did a treatment for her. This is the glow treatment using our polynucleotide whereby we inserted in the dermis layer those so-called DNA fragments. Sabi nga ni Christine, maganda na, may igaganda pa. That's what we like. Actually, her skin is already healthy looking. It's a matter of maintaining it and prejuvenation, preventing aging. There's a term called you prejuvenate. Oh, diba? How young are you na nga ba, Christine?
24.
Still a baby. Okay. So for now, we'll have like a part 2 of that treatment. Now, I also did an assessment for her. On the upper part of the face, we notice a bit of a hollowness on the temple region. Sometimes it's genetics eh. It could be like in your family, it runs in your family. And another cause din kasi is the volume loss from aging. Hindi ka pa naman nag-age eh. So it could be a genetic thing, something that you had inherited. So for now, we have to already do prejuvenation. So on the temple area, okay, what we do is like we mark this part here, lateral orbital rim, and then the temple fusion line. Those are like anatomical markings. So you have your temple fusion line and your lateral orbital rim and the so-called superior border of our zygomatic arch, and the hairline is the posterior one. Now for doctors, we avoid the so-called superficial temporal artery here. Actually, I'm already palpating it and it is exactly located here, this part. So where do we inject? Inside the square here, like a 1 cm from your temple fusion line and a 1 cm from your lateral orbital rim. So we inject in the meeting point of those two lines. Easy, no? And then after I have injected a volumizer for the temple, I'll improve yung under eye ni Christine. Kasi ang batang to, maagang natutulog. Okay? Maaga na. Maaga na. Like 1 a.m. 3 a.m. 3 a.m. There you go. So, we need to also improve the condition of her under eye. We wanna prevent the, progression of the infraorbital hollowness. So, this part here, you palpate for the lower bony orbit. And we will just improve this under eye area Okay, so the substance that I will use for improvement of this one will be a so-called, again, a DNA fragment called polynucleotide. Because last time we also used that. And we will do an overall DNA fragment, again, polynucleotide, all over the face. Kasi, Christian, I noticed, di ba, you're prone to redness. Yan. Rose-colored skin ka kasi. Rosacea. Yun. Royalty skin po kasi si Christine. Yan. So, we will also do a treatment all over the face. We'll be using a microneedling device to infuse that polynucleotide to help also in the skin regeneration and improvement of the overall quality of the skin. Ang dami na, no? Yun. Okay. So, I'll mark again the other side just to finish with this, and then we'll do the injection. Okay. And then the square part here and lower bone orbit. So, we'll just proceed with our injection. And I'll make my marking for my entry point here. And same thing on the other side. We'll use the cannula technique. Christine is a bit sensitive when it comes to pain, so we have to be very gentle for her. Right? Yeah. But they said that no pain, no gain, Christine. So, okay, as much as possible, we'll make it a painless treatment. I'll start with hyaluronic for the temple improvement. How are you, Christine, so far?
I'm nervous.
Okay, paki-spray. So I'm using a pain freeze. A while ago, we cleansed the skin. We left a numbing cream, a so-called lidocaine cream to numb the skin area. You leave it for like 45 minutes. And I have a hyaluronic substance here. And I'll need a dry gauze. And I'll pull the skin like this and onto the bone. So this is a tiny prick. Inhale, exhale. Okay, I'm already onto the bone. Then I still do a so-called aspiration technique, because we know we have to prevent any vasculature insertion or like the placement of a product into that structure. Okay, then I'll check the needle hub, and it's negative for any color red there. So I'll just inject gradually or slowly the hyaluronic substance. Christine, ang hyaluronic, it's so-called aminopolysaccharide. So it's present in our skin, it's present in our system. So this is something natural, okay? So this is a very good volumizer, especially if you have yung lubog na temple or anything hollow. So you can use this product to restore volume. And the best thing about this is that it's giving an instant volumizing effect. So if you have an event tonight or later or tomorrow with this kind of treatment, actually, I could say there's really no downtime to it, because it's just a simple technique like this. So just a simple injection, a one injection point. So this is sometimes called a gunshot technique, okay? So onto the bone, we want to lift the corner of the eye as well. For those with hooded eyes or saggy eyes, this is the best treatment to also do a lifting effect, okay? I'm done with the half ml of my hyaluronic substance on this part here. And then what you do after is just do a molding massage. Done with that, then let's go with the eye. How are you? So far, so good. Later on, we'll still show the result for Christine. Totally understand, a little bit of an anxiety there, but you're in good hands, okay? So it's important that it's done by trained medical doctors in the field of aesthetic medicine. So I have an introducer needle. I'll just prick a little bit, okay? Tiny prick lang ha. Parang the tiny needles we have been using in the past. And then we'll be removing this needle in a little while. I do understand it's a sharp thing. Then let's remove it. So I'm using a polynucleotide specific for under eye area, okay? So there's my entry point, and I'll glide it in a soft tissue layer, okay? I'll already push a little bit of the product little by little, and then I'll just advance towards the so-called medial canthus. So I call this technique anterograde, linear anterograde. And then that's one. And then I'll go back again, okay? So for those with concerns of dark circles, hollowness under the eye, or wrinkled under eye, or thinning of the skin under the eye, or loose skin under the eye, this is the best treatment for that, okay? So, Prejuvenation, Christine, right? So, we want to retain that young look forever. Pwede mo na daw i-retain yung look mo when you're doing procedures. Parang ipopose mo na yung youthful face if you're doing treatments. Okay, I understand a bit on this side here, some discomfort, but we're almost done. Half syringe only here. So placement is subdermis for this kind of product material. You can also inject it into the dermis, deep reticular dermis. Okay, there you go. Now, I'm just gonna do half of the so-called microneedling treatment. And in the microneedling treatment, we have cocktail of your polynucleotide. And actually, you can also add skin nutrients, any skin boosters that you have, skin boosters like vitamins, minerals, even your peptides, amino acids. Some are putting in like growth factors and other important elements or nutrients for your skin. And we're proceeding with the microneedling. So it contains polynucleotide as well and skin nutrients. So I'll be starting at the lower part of the face. So instead of doing the individual papule technique or the bleb technique, this is using multiple pins and infusing the micronutrients in the dermis layer already. So this is gonna improve further the skin quality, the skin texture, skin integrity for Christine, okay? This is something that's very good for individuals, especially if you don't want to really put a lot of makeup, that you just come out bare skin. This one is really improving the quality of your skin, even the hydration and even regeneration and even stimulation of fibroblasts to synthesize your collagen and elastin. So anti-aging pa rin. So we're already infusing those micronutrients. So some of the techniques that I use for this one is like the podge technique or the so-called papule or bleb technique or point-by-point technique. So this is a good technique. It's more comfortable. Plus, it doesn't give you a downtime because it doesn't create those lots of blebs, okay? So we're almost done with the half side, and after this, we'll just continue with the left side. So I'm just gonna finish up a little bit with the temple region, okay? Temple area, and then a little bit on the forehead region. So we have here the filler a while ago. Now, it's also good for individuals with those fine lines and wrinkles on the forehead area, especially static wrinkles that cannot be treated by your botulinum toxin. So this is a good alternative for those kinds of individuals with concerns of fine lines and wrinkles on the forehead. Plus, it also improves skin laxity. And other patients of mine also with pigmentations, melasma, or other kinds of pigmentary conditions, this is also beneficial. So apart from being, you know, prejuvenation for individuals who want to correct any problems on their skin, any skin imperfection, this is a very good treatment. Okay, let's now proceed to the opposite side. So we have done combination procedures for Christine. We did temple filler, under eye polynucleotide treatment, and a multiple microneedling treatment with our polynucleotide. We'll show the result when we return. And we're back. So let's show the result to Ma'am Christine. Christine, here's our mirror. So we did the temple volume filler. We also did under eye polynucleotide, and we did microneedling for our polynucleotide delivery. How are you, Christine?
I'm okay, Doc. Ang
She's
bilis.
okay. I know, right? Yeah. And I could say there's no downtime to it. Look at her. We just did all those needlings, right? Although a while ago, while we were doing it, you'll be expecting like pinpoint bleeds, micro bleeds, okay? But it's gonna quickly heal or recover, especially if you're using that polynucleotide DNA fragment. Examples of those are like, of course, your famous Rejuran, okay? So when you also infuse that into your skin, there's a quick recovery, and like it's also helping in the repair and in the healing, okay? So she's just so young. So when you start early, the better, because you're preventing, you're delaying the aging process. You know what? Aging starts at 20 right now. Like yearly, you'll have a decrease of your collagen 1 to 2%. Collagen, elastin, and other dermis extracellular matrix protein. So what you're doing is great. You're taking good care of yourself, your skin. You're maintaining that good quality. Plus, you want natural result. You don't want the artificial one. And you still want to retain your original look, okay? Yeah. So you love your parents. You have to maintain that look. Plus, of course, we're Asians as much as possible. I'm proud to be Asian. I'm proud to be Pinoy. Yan. Plus, the quality of the skin. I know na trending ang mga Korean skin, right? Yeah. So everywhere we go, I think whichever part of the world they're talking about these Korean skincare products, and we know that polynucleotides, the Rejuran, started in Korea. So we're also applying it here, and it's really beneficial for the improvement of the overall skin quality. Tsaka malakas makapag-boost ng confidence. Yan. How's your experience naman, Christine?
Nag-expect ako ng super sakit dun sa microneedling, Doc.
She was so scared.
Pero hindi ko na ginamit yung stress ball.
Ayun.
Yeah. Okay lang pala siya. Like,
exactly.
Super,
yan nga kasi some people are saying, oh, mukhang masakit yan. Yeah. So, with Christine's experience, especially Christine has a low threshold for pain, and she was able to tolerate everything. Yan. Tumatapang ka na lang. Like in life, kailangan matapang lang lagi tayo. Christine, thank you so much.
You,
okay, for trusting us.
Of course.
And God is good all the time, you know. God is always blessing you, and we always pray for a continued success in your career. Yan. Diba? May kasamang prayer. Yun. Yan. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Actually, nagpa-follow ako kay Christine Lim eh. Saan ka ba nila pwedeng i-follow, Christine?
You can follow me on Instagram and TikTok at @LimChristine.
Yan. Marami kayong matututunan, especially skincare. Even lifestyle yata, no? Healthy lifestyle. So, meron siya mga contents doon that we can learn from. And thank you so much for sharing, of course. And yun. So, also watch our other videos at our YouTube channel, Contessa Salvador. And our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 and or 0917-504-4268. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.